What if I told you that one of the greatest threats facing people with cancer today is not a new disease, not a new side effect, or even a new treatment challenge? What if one of the greatest threats is information itself? Every day, people living with cancer are flooded with claims, promises, opinions, videos, reels, podcasts, influencers, miracle cures, conspiracy theories, supplement stacks, and stories that sound convincing but may not be true. Some are harmless, some are expensive, some delay treatment, some destroy trust, and some can be downright deadly. The difficult part is that misinformation rarely arrives wearing a warning label. It often arrives wrapped in hope, confidence, personal testimony, and certainty. Today, we are going to talk about why misinformation spreads, why smart people believe things that are not true, why cancer seems to attract misinformation like a magnet, and how patients, caregivers, and healthcare professionals can think more clearly in a world overflowing with misinformation. Let's talk about it. This is the After Cancer Podcast. I'm your host, oncology physical therapist, Dr. Leslie Waltke. For more than 3 decades, I've walked alongside people living with and beyond cancer. Whether you are a survivor, a caregiver, or part of a clinical team who cares for them, I'm glad you're here. Because life after a cancer diagnosis can feel uncharted and confusing, even when you have a great medical team. In this podcast, evidence, empathy, and the real human experience come together to help you navigate the physical, emotional, and practical realities of cancer and the life that comes after. This is the After Cancer Podcast, rooted in medicine, spoken in human. Hello, After Cancer community, and welcome to episode 17, Why Smart People Fall for Cancer Misinformation. This episode is brought to you in partnership with Cure. Over the last several episodes, we have explored some of the most difficult parts of the cancer experience. We talked about relationships in episode 14. We talked about learning to trust your body again in episode 15. We talked about the uncertainty of living with metastatic disease in episode 16. Earlier this season, we completed our Cancer 101 series covering what cancer is, how surgery works, how chemotherapy works, and how radiation therapy is used. Those episodes provide a foundation for today's conversation, because the more we understand the basics, the harder it becomes for misinformation to take root. Today, we are talking about medical misinformation and culture. And I want to begin with a story. Several years ago, I met a patient who spent months researching treatment options after her diagnosis. She was intelligent, educated, thoughtful, and motivated. Eventually, she encountered a series of videos claiming that cancer could be cured naturally if the body was detoxified correctly. The videos were polished. The speakers were charismatic. The testimonials were everywhere. There was certainty everywhere. She delayed her cancer treatment. By the time she returned to her oncology team, her disease had progressed. And this story is not about blaming her. Her behavior makes perfect sense when we understand how human beings process information. Most misinformation is not believed because people are foolish. Most misinformation is believed because people are human. One of the biggest myths about misinformation is that only uneducated people fall for it. Research repeatedly shows that intelligence alone does not protect us. In some cases, highly educated people become extremely skilled at defending beliefs they already hold. We search for information that confirms what we hope is true. Psychologists call this confirmation bias. And cancer creates the perfect environment for confirmation bias. Fear increases, uncertainty increases, control decreases. Human brains do not enjoy uncertainty. We are prediction machines. We want answers. We want certainty. We want a roadmap. Unfortunately, certainty is exactly what misinformation often sells. Science typically speaks in probabilities. Misinformation usually speaks in guarantees. One says, this treatment option improves outcomes based on our current evidence. The other says, this secret cure works every time. Well, which sounds more emotionally satisfying? The guarantee, of course. That is one reason misinformation spreads so effectively. Another reason is that stories are powerful. Patient stories matter. Stories help us connect. Stories help us learn. Stories help us feel less alone. But stories also have limitations. If one person takes a supplement and feels better, that experience is real. It matters. Yet it does not automatically prove that the supplement cured cancer or improved survival. Humans are wired to learn from stories. Science exists to determine whether a story reflects a broader reality. An interesting fact is that for most of human history, stories were one of our primary survival tools. If someone ate a berry and became sick, you remembered that story. If someone crossed a river safely, you remembered that story. Stories helped keep people alive. Modern medicine, however, requires a different level of testing. It requires asking whether an experience is repeatable across hundreds of thousands of people. Now let's talk about social media. Social media is neither inherently good nor inherently bad. It can educate, it can connect, it can reduce isolation, it can amplify patient voices. It can also accelerate misinformation at a speed never seen before in human history. Most social media platforms reward engagement, not accuracy. So fear spreads, anger spreads, outrage spreads, certainty spreads. Nuance usually does not. A video titled, "Everything Your Doctor Told You Is Wrong," will often receive more attention than a video titled, "Current Evidence Suggests a Moderate Benefit." One creates an emotional response. The other communicates science. This is not because people are irrational. It is because people are emotional, and emotions are powerful. Let me tell you another story. A caregiver once told me she spent hours every night searching the internet after her spouse's diagnosis. At first, she felt empowered. Then she felt overwhelmed. Then she felt terrified. Every search seemed to produce yet another warning, another treatment option, another controversy, another person claiming everyone else was wrong. Eventually, she realized she was consuming information faster than she could evaluate it. Many listeners will recognize themselves in that story. More information does not automatically create more understanding. Sometimes it simply creates more anxiety. One of the cultural changes we have witnessed over the last decades is the rise of the influencer. Historically, expertise was often associated with training, experience, and credentials. Today, visibility is frequently mistaken for expertise. Someone with millions of followers may appear trustworthy simply because they are popular. Popularity and expertise are obviously not the same thing. A person can have tremendous expertise and very little visibility. A person can have tremendous visibility and very little expertise. The challenge is learning the difference. Now let's discuss a phrase that appears constantly online. Do your own research. At first glance, that sounds reasonable because people should be curious, they should ask questions, and they should learn. But here is an important distinction between gathering information and actually conducting research. Reading 10 social media posts is not research. Watching 20 videos is not research. Research is a systematic process designed to reduce bias and test ideas. This matters because people confuse information consumption with evidence evaluation. So then how should we evaluate claims? Well, first, consider the source. Is the information coming from a recognized cancer professional, from a recognized cancer organization, an academic institution, or a professional society? Or is it coming from someone selling a product? Second, what evidence is presented? Are there studies? Are the studies human studies? Are they large enough to be meaningful? Is the claim based only on testimonials? Now, third, does the person acknowledge uncertainty? Ironically, experts who admit limitations are typically more trustworthy than people who claim certainty about everything. And then fourth, follow the money. Financial incentives do not automatically make information false, but it should encourage scrutiny. And fifth, ask yourself whether the claim sounds too good to be true, because in healthcare, it often is. Now I want to address trust. Many people do not fully trust healthcare systems. Some have experienced poor communication. Some have felt dismissed. Some have experienced inequities. Some have watched loved ones suffer despite receiving excellent care. Trust is complicated. The answer, though, is not blind faith. The answer is also not blind skepticism. Healthy skepticism asks questions. Cynicism assumes every answer is a lie. Those are very different mindsets. Patients should ask questions. Patients should seek second opinions and third opinions where appropriate. Patients should understand their treatment plans. Patients should be active participants in decision-making. But there is a difference between questioning information and rejecting expertise altogether. If your roof is leaking, expertise matters. If your car breaks down, expertise matters. If you have cancer, expertise matters too. Not because experts are perfect, but because expertise improves the probability of being correct. And probabilities matter. Cancer care has dramatically improved over the last several decades. Survival has improved for many cancers. Treatments have become more targeted. Side effects are often better managed. Rehabilitation has improved. Supportive care has improved. These advances did not occur because somebody posted a viral video. They occurred because researchers, clinicians, advocates, and patients spent decades testing ideas and learning from the results. The scientific process is not glamorous. It is slow. It is imperfect, but it works. Another reason misinformation gains traction is because science is often misunderstood. Many people think changing recommendations means science is wrong. In reality, changing recommendations is evidence that science is working. Good science updates itself when new information becomes available. Imagine if oncology practiced exactly like it did 30 years ago. People would suffer. Progress requires adaptation. Progress requires learning. Progress requires changing our minds when evidence changes. That is not weakness, that is wisdom. And here is another cultural issue worth discussing, and that is identity. We increasingly live in a world where beliefs become communities. Communities become identities. And once a belief becomes tied to an identity, changing your mind can feel emotionally threatening. This happens everywhere. Politics, religion, wellness, fitness, healthcare, cancer communities. No one is immune. If accepting new evidence feels like betraying your community, rejecting evidence becomes easier than changing beliefs. That is why intellectual humility is so important. Intellectual humility means recognizing that we might be wrong. It means remaining open to new information. It means saying, I've learned new information, or I have changed my perspective. Those are not signs of weakness. Those are signs of growth. Let me share one more patient story. I once worked with a survivor who became convinced that every symptom represented recurrence. Every ache, every pain, every sensation. Social media groups reinforced the fear. Search engines reinforced the fear. Online stories reinforced the fear. Eventually, she realized something important. She was spending so much time preparing for disaster that she had stopped participating in life. That realization changed everything. Information should help us live. Information should not consume our lives. That distinction is important. As we begin wrapping up, I want to speak directly to patients and caregivers. You do not need to become a scientist. You do not need to read every study. You do not need to spend your evenings arguing with strangers online. You simply need a framework. So slow down. Find physicians and healthcare providers you feel are trustworthy and are comfortable asking questions with. Consider sources. Look for evidence. Beware of certainty. Be cautious of anyone claiming they alone possess the truth or that somebody is hiding things from you. And as always, remember that hope and evidence are not enemies of each other. You do not have to choose between them. Some people believe evidence destroys hope. I would argue the opposite. Evidence helps us place hope where it is most likely to help. And hope is only strongest when it is connected to reality. So here are a few reflection prompts for you to consider. And again, please share your answers in the comments. I love reading them. Number 1, when you encounter health information online, what signals make you trust it? Number 2, have you ever changed your mind about an important belief? What helped you do that? And number 3, how can you balance curiosity, hope, and critical thinking when making healthcare decisions? If you found value in today's conversation, please share this episode with someone who may benefit from it. Subscribe to the After Cancer podcast, leave a review, and explore our earlier episodes, including the Cancer 101 series, the relationship earthquakes, Can You Trust Your Body Again After Cancer, Living with Metastatic Cancer. If you are a healthcare professional looking to improve cancer rehab services, patient outcomes, education, or leadership development, please visit the Walke Cancer Rehabilitation Academy for CEU courses, consulting, and speaking opportunities. Next week, we arrive at episode 18, the final episode of season 1. And ironically, as we close season 1, we are talking about the myth of closure. Many people believe and hope that cancer ends with a final treatment, a final scan, or a final appointment. But what if closure is not something cancer survivors ever truly receive? What if the expectation of closure inadvertently creates unnecessary suffering? We will explore these questions as we explore endings, identity, uncertainty, transition, and what it means to keep living when the story never fully wraps up. You will not want to miss it. Oh, and in case you were wondering, yes, there will be a season 2 of the After Cancer podcast. And to be sure you will be alerted to the season 2 arrival, make sure to hit the subscribe button on YouTube or wherever you listen to your podcasts, and join the After Cancer email list so every episode gets sent directly to your inbox. And before we wrap up, a quick shout out to ABCD after breast cancer diagnosis. ABCD provides free, virtual, personalized emotional support by matching anyone impacted by breast cancer with a trained volunteer mentor who has a similar lived experience. Learn more about getting support or about becoming a mentor at abcdbreastcancersupport.org. Thank you so much for spending part of your day with me. I appreciate your time. Remember, science and humanity can and should belong together. Cancer may change people, but it should never erase them. You are not alone, and yes, you belong here. And of course, exercise like your life depends on it because it does. Peace out. Let's talk again soon.